question. Sorry?
Sorry, I was just coughing.
Okay, sorry. I thought you said something.
Sorry. Sorry.
Right, so if you have read and understood considering a clinical examination station, kindly please begin.
Good evening. I am Dr. Saga. I am one of the exam candidates here. May I please confirm your name and your age, please?
I'm Smith, 66 years old.
Okay, Mr. Smith, I have been asked to examine your hips today, for the purpose of your diagnosis and management. For this examination, I will be looking at and I will be looking at and touching your hip joint and your legs. Will that be okay with you?
Yes,
Okay, Mrs. Smith, for this examination, I would like you to please uncover your gown, and you will be wearing all your shorts and you will follow my command. If you feel any kind of pain or difficulty, you will please let me know. Okay, can we begin?
yes.
Okay, Mr. Smith, um, can you please remove your gown and stand here for me? And
Okay,
then after that, I will request him to stand in front of me,
yes.
and then I will. Yeah, Mr. Smith, can you please look at the right side? Uh,
Okay,
Change your posture to the right side. Can you please change your posture towards the left side?
okay.
Okay, Mr. Smith, now I would like to examine your back, if that's okay.
Yes,
Okay, Mr. Smith, now I would like you to please walk towards the wall. I will be walking beside you. And if you feel any kind of pain or if you feel any dizziness, please let me know.
okay.
Now the patient is walking. Okay, now I want you to please come towards the bed.
Yes,
Okay, Mr. Smith, now I am going to touch you. If you feel any kind of pain, please let me know. And
okay.
now I will expose the now like I will expose the posterior buttocks of the patient to look for any muscle wastage or any kind of scar marks or visible deformity. Now I will request the patient to please sit down on the couch, lie down on the couch. I will touch the hip joint and look for temperature and tenderness.
Okay.
um, Now I will perform active and passive movements at the hip joint, uh, flexion, extension, adduction, and abduction. And meanwhile, I will ask the patient if there is any sort of pain on any of these joints. Um, and then I will perform certain now, Mr. Smith, I'm going to perform certain tests on you. Like I will check for limb length discrepancy, uh, and then I will perform the Zillie's test.
Continue, please. I'm listening.
After that, I will cover the patient and say thank you.
Are you sure you've done all the
So I forgot one test. I forgot the name of that test.
Trendelenburg test?
Yes, Trendelenburg test.
How do you do that?
I will request the patient to stand on one limb, and meanwhile I will hold the patient and
Yes,
then change the limb, and then I will look
yes,
for the tilting of the pelvis.
yes.
And then there was another test. Forgot that test as well.
Okay. What else would you be looking at? What
During
do
tender bug test,
yes, what do you expect to see? What should be the result?
the normal side will dip
Sag.
down.
Yes, sound side sags. And then what else test?
Thanks.
Which other test would you be doing?
Madam, I forgot the name of the test that is done for osteoarthritis.
Okay. All right.
I forgot the name of
If
that test.
you have forgotten any other test that you'll do,
The laziest test to look for limb length discrepancy.
okay.
Li-
You also said that you'll be doing the movements. How would you do? Would you do the active? Would you ask the patient to do active movements first or the passive?
I would request the patient to do the active movement to look for if,
Yes.
and I will look at the face of the patient to check for any kind of grimace or if the
Yes.
patient is feeling any kind of pain. And then I will perform the passive movements.
Yes. All right. So what are the all the movements that you expect to see at hip joint?
Flexion, extension, adduction, abduction, internal rotation, external rotation.
Right. So, all right, Bell will be going soon. So, can you summarize your examination, please?
My patient is 66 years old male, 66 years old male patient was lying, was sitting comfortably in the chair. I greeted the patient and asked for the consent. Um, the patient has a positive frontal bug gait with the hip tilting to the hip sagging towards the left side.
Yes,
The patient had no limb length discrepancy. The disease test was negative. The active adduction and abduction of both the limbs was normal,
yes.
and internal rotation and external rotation was painful. Internal rotation was normal, and
So, what are your provisional and differential diagnosis for this patient?
um, it could be inferior gluteal nerve injury or osteoarthritis.
First, you'll mention osteoarthritis, then it could even be,
Gluteal nerve could be a
yes.
gluteal nerve injury.
All right, okay. How would you confirm your diagnosis? What investigations would you ask for?
I will request complete blood picture
Yes,
and X-ray of the hip joint
yes,
um, with both the lips with both the hips, and I will also like to perform the spine examination and examination of the knees and the neurovascular examination of the lower limb to confirm my diagnosis.
okay.
And
Yes, all
MRI,
right.
and for this patient investigation, I would also perform MRI to look for any soft tissue deformity in
Okay.
this patient.
So what management would you suggest for the patient?
Um, I will start with counseling of the patient, and then analgesia will be. I will offer the patient analgesia, and
What
depending on
counseling?
the investigations,
Conservative management or counseling? What would you counsel the patient about?
I will I will tell the patient about the disease of the patient, and if it's I cannot
What are
define
the
this.
non-operative measures that you can take for the patient to reduce the pain?
Analgesia, physiotherapy,
Yes, and
and shoes,
you'll
customized shoes,
advise the patient for the weight loss depending upon the weight of the patient.
weight loss,
Yes,
okay,
occupational therapy. Then,
occupational therapy.
what are the invasive measures that you can offer to the patient?
Um,
Yes.
Osteotomies. No,
That is too advanced, but before that, you can maybe offer intra-articular, intra-joint corticosteroid injections,
okay,
and then arthroplasty.
orthoplasty.
Yes. Okay. Do you know how Thomas test is done?
Yes, ma'am.
Yes, that was the one you missed.
Thomas test
Okay,
is
so
yeah,
yes,
that was a test. Right. Thomas test is performed by stabilizing the patient's by putting one hand under the spine of the patient and uh, performing flexion at one hip joint of the patient. When this flexion is performed, the scoliosis, if present in the spine, becomes more prominent, and also the contralateral limb may rise if the patient has osteoarthritis.
yes. And you, if Thomas test happens to be positive, then you're not going to do the extension of the leg. All right. You've already told me. All right.
I
What would
will.
you do to complete your examination? You
Um,
told me you'll do the knee
I,
and spine examination. What else would you do?
the
The
neurovascular examination of the
assess.
lower leg.
Yes, yes, yes. Very good. Good. Thank you.
Yes, it will it will improve, inshallah.